Hey there, I'm Dr. Barbara Woods, and I am happy to be back again to talk to you about more things related to intergenerational trauma therapy. And today we're going to talk about the urgency for specialization in trauma in general, but also in treating intergenerational trauma. So we're going to look at some worldwide statistics and some of the current events that are happening and how these relate to intergenerational trauma therapy. So trauma therapy is a specialized form of therapy. It's an area of clinical expertise. Unless you go to a university that really specializes in trauma and has advisors that are deeply researching and working with trauma, you may not get much training in graduate school, and you may have to develop that after graduate school. And there's tons of different interventions, so it can get pretty overwhelming pretty quickly. Intergenerational trauma therapy is a subspecialty of that trauma therapy. So it's much more defined and kind of narrowed, but it's also very complex. So it can be very difficult to feel like you've got kind of the specialization nailed down. Right now, intergenerational trauma is hugely prevalent. I don't have statistics on it, but with COVID, we had increased rates of depression, anxiety, suicidal ideation. Those were some of the mental health impacts, and that's going to disrupt attachment with children, which is going to lead to some of that intergenerational trauma. Also, the war in Ukraine, there's intergenerational trauma in history, but there's also the current context that can cause multiple layers and levels. Then we've got the war in Israel-Palestine. Both of those populations have huge amounts of intergenerational trauma for centuries, really. So there are so many specific things that are happening. And then there's also all kinds of human rights cases and traumatic living conditions. Right now really is the time to get these skills and get it down so that you can effectively treat these populations. With the Intergenerational Trauma Program and all the programs that I have, the calendar, the 2024 Intergenerational Trauma Therapist Immersion Calendar, the Intergenerational Trauma Toolkit, they're all based on a similar foundation. First, they incorporate the polyvagal theory for the foundation of attachment. So this is all about regulation of the self and co-regulation in the therapist-client relationship, but also in the parent-child relationship to improve attachment and really create a foundation of regulation for attachment. It's also based on current neuroscience and relational neuroscience and updated attachment interventions. It creates a streamlined and consistent framework for intervention between parents and children and teens. What frequently happens is if you use an intervention for the parent, say EMDR, and then you use trauma-focused CBT with a child, the language that they use and the way that they understand it is going to be very different between those two. Because we're working with a family rather than just one individual, we want those interventions to be streamlined across all the people that we're working with so that they can recognize things better. They can recognize regulation, dysregulation, they know about co-regulation. So this is all really important to have that consistent and streamlined framework. So now we're going to look at the current mental health trends. And there was a Harvard article in July of 2023. It said it was by the Queensland's Brain Institute. If you want the link, I can certainly provide that. They looked at 27 different countries around the world from 2001 to 2022. This is a 21-year study about the incidence and prevalence of mental health disorders in, I think it was mainly adults. The most common mental health disorders among women were depression, a specific phobia, so a disabling fear that interferes with their daily life, but it's kind of conscripted to one area, like possibly like cats, dogs, riding in vehicles, those kinds of things where it's a very specific phobia, and post-traumatic stress disorder. So if that's one of the most common disorders for women during this longitudinal study, there's a high potential for intergenerational trauma. So for men, the mental health disorders were more alcohol abuse, depression, and again, a specific phobia. So there's also groundwork for having intergenerational trauma transmitted from parents to children. They found that these mental health difficulties usually begin in childhood, adolescence, and young adulthood. There's another indicator for intergenerational trauma. The first onset of the symptoms tended to be around 15 years old, but the medium, the most likely, was around 19 for men and 20 for women. The onset in childhood, adolescent, and young adulthood is likely related to difficulties in the parent-teen relationship, in attachment, and maybe the impact of intergenerational trauma. We need to really look at this carefully because the rate of intergenerational trauma is likely quite higher than what we suspect. It's also a global issue. It's not just one thing in one population or community. It's everywhere. This study, interestingly, was independent of the impacts of COVID. It started really kind of at the beginning of COVID and the current global crises. So there's more layers that we have to consider when we're looking at this. Experts have looked at these trends and how it's shaping the use of specialized therapies with these populations. The article and study really point directly to using neuroscience and understanding the development and treatment of mental health problems, especially for young people. So I'm going to read a quote from that Harvard article by a person named McGrath. He says, "This lends weight to the need to invest in basic neuroscience to understand why these disorders develop, as well as mental health services that have a particular focus on young people." He also said services need to be able to detect, treat common mental health disorders promptly and be optimized to suit patients in these critical parts of their lives. So this is where that highly specialized trauma treatment is very important, and particularly for intergenerational trauma, because we need to focus on young people in the context of their family and improve those intergenerational relationships and build resilience in both generations. So there is a rising demand for trauma therapists. The world events are traumatic and disturbing, have increased the level of trauma for the people who are right there experiencing it. But we can watch it worldwide on social media, TV. So the rates of vicarious trauma are also quite high from the media exposure that we're having. If these impacts aren't healed in this current generation, it's more likely that intergenerational trauma is going to occur. It's just going to continue to spread, and it's going to impact the next generation. It's been in the forefront of Indigenous communities for a long time because of the impact of residential schools. So it's been a focus in those communities because they're aware of the breakdown in family structure and parenting and the traumatic impacts of the residential schools. This is really the foundation of where I learned a lot of what I've put together, because it was just so prevalent. But a lot of people aren't aware of the impacts of these intergenerational traumas and how to identify these in the therapy setting. Parents may have gone to several therapists trying to work on the trauma that they've experienced, but they get frustrated because there's a lack of results. And then therapists are struggling to provide interventions that haven't already been used. So a parent may go to a place to get therapy and they may do EMDR, and then they may do trauma-focused CBT, and it just never addresses all the difficulties and issues that they're having. It's not addressing the child's trauma, and if they're working with the child and doing trauma interventions, they're not working with the parent, specifically on the parent's own unresolved trauma. There's a gap in this specialized area of trauma therapy, the interventions are typically individual. So it's usually working with the child's trauma or the parent's trauma, and it might be doing some attachment-based therapy between the child and the parent, but they aren't streamlined and consistent across the parent, the child, and their attachment. It can lead to less impactful therapy across family members, because one of the most important parts of trauma therapy for children is the container at home and how they get the support and the guidance and kind of the coaching that they need after a traumatic event. And those relationships need to be really strong. So it may be less impactful across family members. And the parent may not, if they're not learning the same thing that the child is learning, like about dysregulation and co-regulation and how to do that in an age-appropriate manner, of course, the parent may not recognize that a child is dysregulated rather than being difficult or throwing a fit or a tantrum. That's dysregulation, and they may miss the opportunity to co-regulate and build that attachment. They may also miss regulation and not see those prime opportunities for further deepening the attachment relationship. Or they may not even recognize the traumatic impacts on their kids. They may just think their behavior has always been this way, it'll probably never change, so they just kind of live with it. But those may be the trauma impact. Only parts of the impact of intergenerational trauma are affected in therapy. You might address the attachment impact, you might address the parent's unresolved trauma, or you might address the child's trauma, but it's not done cohesively. Individual therapy for a child impacted by intergenerational trauma is not effective because the child carries the burden for the whole family. And there are certain cases where we're only able to access the child and provide the child with therapy, either because of a family disruption or separation that we have no control over. But there's still caregivers in that child's environment that can help provide an attachment-based and trauma-informed environment to address these impacts. When trauma goes untreated in families or in an individual, there's impacts to specific brain structures, and these brain structures are typically related to autonomic regulation, so that's your fight, flight, freeze, kind of defensiveness or shutdown, and emotion regulation. There's certain critical periods where these circuits develop in the brain, and if there's trauma during these times, that ability to emotionally regulate has been hijacked, so they're not going to develop those circuits as strongly as they would have had the trauma not happened during that period of time. Fortunately, the brain has plasticity. We can influence these circuits, we can help make them stronger, but if we don't, the impact on those brain structures are going to create difficulties in relationships with adults, with peers. Later on, it'll create difficulties in primary relationships, work relationships, all kinds of relational difficulties because they don't have that regulatory, and they have kind of explosive or disconnected emotional responses. And it'll disrupt attachment. That's going to further make relationships more complicated and difficult. Attachment disruptions that occur in a parent-child relationship has a further impact on that autonomic regulation and the emotional regulation in that child and teen generation. If these aren't addressed and there's trauma early on in early development, autonomic regulation circuits are weakened, there's more impacts on attachment, and that will end up causing difficulties with emotion regulation and attachment even more in that child and teen generation. So this is another generation with developmental trauma that may continue into adulthood as complex trauma. The developmental impacts that you typically see with intergenerational trauma and basically developmental trauma are disrupted attachment. Sometimes kids will be very anxious, clingy, can't be separated from their parent. They may be very shut down, not seek out attachment or relationship with a parent, or they may have a mix of both, which they're wanting that attachment and connection, but once they get it, it's terrifying. So they try to shut it down, but they can become quite aggressive or have difficulties with kind of attacking when they're triggered like that. Another area is actually biological development. So there's your brain structures that may develop more difficultly, and some of those circuits that aren't as strong as they should be. It impacts all kinds of hormones, your muscles, organs, tissues. Sometimes there's kind of weak muscles. So there's all kinds of biological things that develop, which later on leads to chronic health issues. Affect regulation is another area that is a problem with developmental trauma because those brain circuits aren't as strong. Then they have experiences where they've become explosive and they've gotten negative feedback. They've had another incident of being either blamed for things or not having co-regulation or having parents, teachers, adults kind of clamp down on that behavior, and they never learn to get out of that pattern. Or they may just be shut down and don't really have interaction, so they miss the joy of life that leads to depression, and they don't have that richness in life that our emotions bring. Another really important part of developmental trauma is dissociation. So this is a key factor in developmental trauma because these kids have to develop some way to protect themselves during all these difficult traumatic experiences in childhood. And dissociation is a brilliant adaptation and it's a coping mechanism, but there's other problems that can come from that. So it can cause disruption in relationships, in learning, in experiential awareness. It causes a lot of difficulties and it can lead to significant mental health difficulties later in life. The next area is behavioral control and regulation. So sometimes these kids will look very impulsive. They'll be diagnosed with ADHD, but it might be the dysregulation of their behavior because they haven't learned to develop that, or they're constantly in an autonomic state that deals with survival and threat. So they overreact, they have faulty neuroception, and they tend to be behaviorally out of control. Cognition is also impacted because the lower brain structures in the limbic system are taking all the energy really in the brain when you're in a fight or flight state or when your autonomic nervous system is dysregulated, and it pulls energy away from the cortex where more learning and language is developed. You'll have sometimes glitches in academics, you'll have language difficulties. You'll see all these impacts in school and learning, and they'll have poor self-regulation. That's the last area. This has to do with poor affect regulation. They can't control their emotions, they can't control their behavior, and they really don't have the skills to have that self-regulation because they haven't had the co-regulation with a caring adult. As adults, when these impacts continue on, they can have, this is where the difficulties with attachment with their own children come in because they haven't learned those skills when they were younger and they just kind of carry on. They can have difficulties in relationships with their children, but also difficulties or instability in relationships, which creates a more stormy interpersonal environment that their child is then exposed to. They can have a higher incidence or difficulties with chronic medical conditions because of the impact on the physical development. They can have significant emotion dysregulation, so they can just be somebody that shuts down and tucks into themselves rather quickly and for long periods of time, or they may be defensive and become upset very easily and not able to regulate that. And they can't rely on relationships to help regulate that because of the attachment impacts and the interpersonal relationship impacts that they've experienced. Dissociation also continues on into adulthood, so you'll have these disconnections in experience, whether it be at work, school, home, And they sometimes feel very disconnected or aloof in relationships because they're not fully present. We have all kinds of substance abuse and negative coping strategies, over-exercising, overeating, compulsive cleaning, and substance abuse are all of those strategies that are there to try to regulate that dysregulation of the autonomic nervous system, but they cause other problems and they cause the continued transmission of intergenerational trauma to the next generation. They can also have difficulties with processing information. They can have educational and occupational impacts where it might be hard for them to critically think about a situation at work, or they can't achieve the same level that they could have if they hadn't had all this trauma when they were younger. So there's some limits that can happen, but people are very resilient, and I've seen some people really overcome these and do very, very well. So the difficulties that a parent has with self-regulation because of their complex trauma, this is part of the main factor that negatively impacts their co-regulation with others and passes on that intergenerational trauma. It's really important to address these difficulties and get them the skills that they need so we can stop that transmission. When we stop the transmission of intergenerational trauma, we're actually stopping the impact or the intensity of the developmental impacts on the child. So it will shut the impact of the trauma down, and then the difficulties in the developmental impacts can then be addressed so that they have a different path in life. So it prevents the full and continuous impact of those developmental disruptions. They're also less likely to experience complex trauma as adults. So their adult life, we can never take away that trauma, but the impacts can be minimized and they can do quite well. It also arrests it for the third generation of the people who are children now. For their children, it gives them a different experience. So we're really shifting the whole family system across multiple generations. And sometimes the impacts are in layers and generations. So any improvement sets the momentum in a positive direction. So any addressing of the developmental impacts. So the benefits of specializing in trauma therapy, and particularly intergenerational trauma therapy, is that early adopters will really create a leadership role in the field. There's not much that's been published on this. There's one book, there's several studies, but there's no specific treatment programs that are designed that are based on current updated neuroscience. The more impactful and successful therapy skills and outcomes are, the more referrals they get, the more specialized they can come, and it really supports the therapist practice, which therapy isn't about the therapist, but we have to take care of ourselves and we have to have meaning in our work to be able to continue to do it. So this is one way that helps support the therapist and the practice so that they can help more people. It's also less likely to cause burnout because we've got this framework, we've got these skills, we can manage these complex cases, and they may be difficult, but we have kind of a roadmap of how to intervene and how to help them. Ultimately, it helps the therapist's career span to be longer and more meaningful, because if we get burned out early on in dealing with really complex cases, the longevity of our career isn't going to be there, because this is a career that has a high burnout rate and some pretty negative impacts on the therapist if they don't take care of themselves. And we can see these success stories in people who started working with EMDR or brain spotting or DBT, and how they've highly specialized and they've been able to go out and be very influential in the field of therapy and with other therapists, and how much that has supported their work and kind of had a ripple effect to help other people. So my question is, are you ready to become an intergenerational trauma specialist? Because I have a special that has been developed for 2024. It's the 2024 therapist, intergenerational trauma therapist immersion calendar that has 12 different themes and different weekly themes, daily prompts to kind of look at these different areas of intergenerational trauma and to really build a foundation of those skills that are necessary in order to have a specialization in the field. So if you are interested in that, you can go to calendar.barbarawoodsphd.com and get a copy of the calendar and join my Facebook group where we'll be discussing all these prompts on a daily basis. So I hope you have a great day and I will talk with you later.